Are you over 50 years old? If so, there are 4 key movements that you should be doing daily to help with your mobility. In this video, I'll share what they are and why they're so important. Functional mobility plays a huge role in maintaining independence as you age. It's also been directly tied to longevity. This means that having greater functional mobility will allow you to live a longer, healthier life. Are you experiencing aches and pains? And do you frequently feel stiff throughout the day, making it harder for you to do the things that you could once do easily? The 4 key movements that we'll cover today will help you improve your flexibility and mobility. They should be done every day, especially if you're over the age of 50. The reason I've selected these 4 movements is because they work key muscle groups related to functional independence for those over the age of 50. They'll work a few different regions of the body that many of our patients struggle with. By the way, my name's Justin. I'm a doctor of physical therapy and own a physical therapy clinic with 7 locations across Southwest Florida. If you're finding this video helpful, please consider subscribing to the Active Adult channel. This allows us to keep providing free content for you each week. A 2020 Brazilian study followed over 1,400 seniors during a 10-year period. The study specifically tracked how functional mobility relates to longevity. They tested participants' abilities to get up from the floor and stand up from a chair. And over the 10-year period, 26% of the participants died, and the vast majority of those who passed away struggled with their functional mobility. The study found that lacking functional mobility can lead to circulatory and respiratory disease. What's worse is that it's tied to cognitive decline as well. Now, obviously, there's a huge range of flexibility when it comes to folks over the age of 50. We're all at different points on our mobility journeys. For that reason, I'll share a few different progressions for each of these 4 movements, starting with the easiest, moving to intermediate, and then the most challenging. Remember to only try what you're comfortable with. You should feel a nice stretch with these movements, but you should not feel sharp or pinching pain. If you're feeling pain, stop and adjust your positioning or simply move on to the next exercise. It's important to get a warm-up before starting this routine, especially if you're doing it early in the day. We often wake up stiff first thing in the morning. Who can relate? So go for a quick walk, jog, or bike ride before attempting these stretches. Let's get started. I want to start off with the shoulder mobility by doing an exercise we call wall walking. Now, shoulder mobility is really crucial because things like doing your hair, washing your hair, putting a belt on, reaching behind the back to get your wallet, those types of things, even reaching up into the top part of the cupboard to grab a cup for your coffee, fastening a seatbelt in your car. I could go on forever, but it's so important to have good shoulder mobility. With wall walks, all you really need is an open spot on your wall. I'll show you later how to make it a little bit harder. But you're going to turn around, get your feet nice and wide, and place your hands up on the wall about eye level. And all you're going to do is slowly walk up the wall as high as you can without pain. And if you feel a little bit of a stretch and you can't go it, then you can kind of lean into it, which should give you a nice stretch underneath the arms, and walk your way back down. This is step 1 of the progression. Step 2 of the progression would be to walk up, get up to the very top, do the stretch just like before, but then lift off one hand and then the other hand before coming back down. When you get really good at that, a simple way to progress that would be to lift both hands at the same time and walk back down. You want to do that 10 or 15 times, nice and slow, very deliberate, okay? If you get good at that, then we can actually work in a little bit of strength. One way to add a little bit of strength to this is by adding a TheraBand. Take a little loop just like this and put both hands through it. Get back up on the wall, spread the hands apart by stretching that TheraBand a little bit, and repeat the same routine that I showed you earlier. Walk up the wall. If it feels good, you can lean in to get a little bit more stretch, lift off, one hand and then the other, or both hands together, and then walk down. It's important to note that this band is going to be trying to pull you in, and you're using your shoulder stabilizers to keep your hands apart. So you're fighting that urge for that band to pull your arms together the whole time, no matter what you're doing. When you feel fatigued here, which you will, this one's a doozy, then you want to take a couple seconds, let it rest, let your arms dangle, and then do it again. Remember, be very deliberate here. Quality is more important than quantity. Next, we're going to move on to your hip mobility with an exercise called Z-sitting. Now, we've done this in previous videos before. It's a great way to work the rotators of the hip. The study that we mentioned earlier tested all 1,400 participants' abilities to get on and off the floor. They found a clear correlation between standing up from the floor and living longer. In our experience working with seniors, one of the biggest reasons why seniors cannot get off the floor, in addition to strength, is the mobility of their hips. If you can't get yourself into position, no matter how strong you are, you're not going to be able to stand up. So what I have is my left leg out in front, and that is turned down into external rotation. My right leg, foot's out to the side, knees turned in, which is internal rotation. I feel a little bit of a stretch on the inside of my hip and maybe the outside of my other hip, but everyone's going to feel this differently depending on how tight you are. I'm going to say this over and over again, but you should be feeling a stretch here, not a pinch. So if you're feeling a pinch in your hip that's painful, not a good pinch, then we need to make this a little bit easier. The way you can make that easier to find that sweet spot of where to start is leaning back. So if I lean back here, now all the stretch goes away. So if you're on the tighter side, then start off leaning back. If you're not feeling the stretch yet, then start walking your hands up and sit up nice and tall until you feel a little bit of a stretch. Start off easy, make sure the next day you're not going to get too sore or anything, and then we can get into it as you become conditioned. Now hold this for about 15 seconds and then alternate legs. So I'm going to bring my right leg forward and go external rotation, and I'm going to bring my left leg back and go into internal rotation. I'm going to prop myself up into that good stretch position, and I'm going to hold that for 15 seconds. Then I'm going to go back and forth between this side and the other side. Eventually, if no matter how tall you sit, you're able to do this correctly, then we want to go to no hands. Because having no hands, it's going to work a little bit more on your core strength, which having a stable core is very important when you're doing functional mobility tasks. So see if you can switch your legs without putting your hands down. Sit up nice and tall. And you might be able to tell, I'm kind of falling off the side a little bit. It's because my left hip internal rotation is a little bit limited. So I would stay right here in this position, going back and forth, for about 5 to 6 repetitions on each side, up to 10 if you're feeling good. I promise you, when you're done doing this exercise, you will feel good, you will feel looser. The third mobility progression I want to show you is lying prone or lying on your stomach. This is a position that most of our senior patients will admit that they don't do very often anymore. They say it's uncomfortable, they can't sleep on their stomach anymore, or else they wake up in terrible pain. Being in an extended position on your spine, which means arched, makes the space for those nerves that come out of your spine a little bit smaller. Or the more time you spend flexed forward or seated is a great example of a flexed position. It might feel good, but what's happening is some of your hip flexors and other muscles that pull you into that flex posture are getting tight with every passing moment. So we have to do a few things every day to reverse the effects of those extended position under flexion. Lying prone is a great one. Now I understand you're not going to want to jump right into doing a bunch of stuff on your stomach, so I'm going to start off with an easy variation with a pillow. So I'm on this mat table, and you probably don't have one of these at home. So if you're comfortable getting on and off the ground and you have a nice soft rug or soft carpet, that's great. You could also do this on your bed. It may be a little bit more cushy, so you might have to use a thicker pillow or 2 pillows depending on how things work. I'm gonna lay on my stomach. Now, I'm gonna put this pillow right here about my midsection, and I'm gonna lay over top of it. And I'm gonna start off on my elbows, which, if that's uncomfortable, you can go down to your hands. I'm gonna start off just staying here. I'm gonna stay here for about 30, 45 seconds, and I'm gonna feel some of those muscles in the front of my hips stretching out. I might feel my middle back stretching out a little bit. And after that 45 seconds, I'm gonna start to bend my knees. Now, when I bend my knees, I'm lengthening my hip flexors in the front, which we're gonna throw up a nice little diagram here, but that's gonna cause you to go into an anterior pelvic tilt or an arched position with your back. What I want you to do though, is keep your stomach tight the whole time, which will force your pelvis back into that neutral position and keep it there the whole time. So I'm keeping my stomach tight and I'm just bending my knees, alternating as far as I can go. I'm gonna do that nice and slow. And I'm gonna go about 20 times on each side. And then I'm going to start lifting my legs by keeping my stomach tight and going 1, about 2 or 3 inches off the table with my knees and alternating both sides. Start off with only about 5 of these because these are a lot harder, and work your way up to 10. So that is my prone progression. When you go the knee bends and you go the hip lifts or hip extensions, that should be about 5 minutes in prone. Once that becomes tolerable, once you can do that without your back starting to get sore or achy, then it's time to take this pillow out, which is gonna make you lay a little bit more flat. Go through the same progression, back and forth with your knees, back and forth lifting your hips. If your back starts to get achy or sore before you get done, stop right there. We don't want to push through pain to get the exercises done. What you want to do is do what you can do today, and then tomorrow when you do it, and the next day, over time, you might be able to squeeze in a few more repetitions before your back gets sore, and eventually you'll be spending the whole 5 minutes in prone. The last progression I'm going to show you are double knees to chest, or working on your hip flexion mobility. There's a reason why I saved this one for last, because we understand that the previous progression of being prone can cause people to be a little achy. So this one is gonna put out the fire that you may have started lying in prone. This is one that almost every patient that we have says it feels good, but you should always follow those same rules of it should be feel good or just a little bit of a stretch, and it shouldn't be pain. If you have a hip replacement or you have hip pain, just go back as far as you can, stop before that pain gets worse, and then adjust. So I'm on my back, I have a stability ball. This is a 55 centimeter ball. If you're a little taller than I am, I'm 6'2", you might get a 65. If you're a little shorter, you can do a 45, but this 55 is a good number, well-rounded. If you want to pick one up, we're going to link to it in the description here. They're pretty inexpensive off of Amazon, but you can also pick them up at your Walmart or sporting goods store. So I have my feet on it, just hanging off just a little bit. I'm going to roll my knees back towards my chest as far as I can, and then go straight again. When I'm going back, I'm not going to keep my knees together. I'm going to let them follow the natural path that they want to take, which is a little bit of abduction or external rotation as I come back. Think about the way that you would naturally squat. Your knees kind of want to turn out a little bit and your toes want to turn out a little bit. That's okay. I'm going to go back and forth nice and slow. You don't want to use momentum here. You want to bring the legs back. You don't want to swing them back. I'm going to do this 20 times nice and slow. And after that, I'm gonna be done. Now, if you lack hip flexion and you wanna work on your flexibility a bit, say you come back and your legs stop about 90 degrees. Then I can take, and it's a good stretch. Maybe you feel a stretch in the back of your hips and not a pain. I'm gonna grab my knees and I'm gonna give it a little bit of overpressure where I pull back, hold it, take a nice deep breath out, relax, and then let it go. I'm gonna add that to it. So if you're one of those people that is really stiff, add this little variation into it, work on your flexibility so that you can have better mobility. Remember, these can and should be done every day, but be sure to get that warm up in first before attempting these exercises. If you found this video helpful, you may also enjoy this video about mobility for seniors. Until next time.